In this video, we will discuss what to expect during your recovery period. Just as every pregnancy and delivery are unique, every recovery is unique too. All patients heal at different rates, so it is important not to compare yourself to others that you know. Your uterus will continue to contract after delivery. This allows your uterus to shrink from the size of a watermelon to the size of a lemon. That's a huge difference. Cramping may increase while you are breastfeeding or when your baby is crying because of the hormone oxytocin. Because your uterus has to shrink, you may still look pregnant for a while, which is completely normal. Abdominal binders, which are compression belts that encircle the abdomen, may be helpful to increase support, but they are not necessary. Some patients want to shower immediately after delivery, while others want to wait until they get home. Both are fine. However, it is not recommended to take a bath or soak in water for at least 2 weeks, as this can increase your risk of infection. Another thing that can increase the risk of infection is placing anything in your vagina, such as tampons or a douche. You will likely have some pain after delivery, regardless of if you had a vaginal delivery or a C-section. This is normal and expected. You may also have generalized muscle aches because having a baby is like running a marathon. We recommend setting a functional pain score, which is the level of pain you are still able to care for yourself and your baby. We recommend using a pain score to better understand and communicate your pain level to your nurses and doctors. You will receive pain medication at discharge, which we recommend initially taking around the clock. We also recommend using non-medication methods like ice and heat packs, massages, or aromatherapy. If you feel like your pain is too much or the medications are not helping, talk to your nurse or your doctor. If you had a vaginal delivery, vaginal tears or lacerations can occur in up to 80% of deliveries. These tears can happen in many locations, including near your clitoris or urethra or on your labia or vagina. It is important to ask your doctor what type of tear you had, because 3rd or 4th degree tears have specific recommendations for recovery. Your doctor will repair your vaginal tears with stitches that will dissolve over the next several weeks and do not need to be removed. Regardless of the type of tear you have, you may have burning or pain with peeing. It is very important to keep your bowel movements or poop soft so that you are not pushing against your stitches. Vaginal or vulvar swelling is very common, especially if you are pushing for long periods of time or if you have a vaginal tear. It can be helpful to use ice packs inside your pads or create pad sickles as illustrated here. You can also use dermoplast to soothe the vulva and vagina. This can be useful prior to and after using the restroom. Small squirt bottles can be used to clean yourself after using the restroom to prevent rubbing toilet paper on sore or swollen areas. Pat yourself dry prior to putting on pants or underwear. Witch hazel pads and wipes may be helpful to relieve itching, burning, or irritation from swelling, tears, and hemorrhoids. Baths with very shallow water, about 3 or 4 inches, called sitz baths, can help relieve discomfort from swelling, tears, and hemorrhoids. You can see an example of a sitz bath here. If you had a C-section, it is important to remember that this was a major surgery and will require time to heal. You can expect to have a catheter or tube in your bladder after delivery. You will have 2 different incisions at the time of your C-section, one on your skin and one on your uterus. These incisions may be in different directions. Ask your doctor if the incision you had on your uterus will allow you to have a vaginal delivery in the future. Following your C-section, you will have a bandage on your belly for 1 to 2 days. Most incisions will be closed using stitches underneath the skin that will dissolve over the next several weeks. These stitches do not need to be removed. You may also have a small adhesive bandage or surgical glue that will peel off over the next 1 to 2 weeks. Other incisions may be closed using staples that will need to be removed by a doctor in 1 to 2 weeks. After your bandage is removed, you can shower. Do not scrub your incision. Instead, let warm soapy water wash over the incision and pat it dry. Avoid putting any creams, lotions, powders, hydrogen peroxide, or rubbing alcohol on your incision while it is healing. You should also avoid clothes that may rub on the incision. This can slow down or prevent healing and may increase the risk of infection. Do not lift anything heavier than 10 pounds for at least 6 weeks to allow your incision to heal. While your incision is healing, it may be normal to have pain at the incision site for the first couple of weeks. It may also be normal for your incision to have a pink tinge as it heals or firm areas caused by the stitches or the tissue healing. This should soften or go away over time. You may also have numbness or tingling around the incision that can be caused by the nerves regrowing around the incision. Each of these conditions should improve over time. If your incision becomes warm, red, swollen, leaks fluid, or develops an odor, you should seek immediate care as you may be developing an infection. The next topic will focus on what to expect with your bleeding. You will have bleeding after both a vaginal delivery and a C-section. This bleeding is also called lochia and can continue for up to 6 weeks after delivery and still be considered normal. Bleeding and discharge will change over time from a bright red to a pinkish brown to a white-yellow color. You can use pads or adult diapers, but we do not recommend using tampons or menstrual cups during this time because they may increase your risk for infection. Your bleeding should decrease over time. Talk to your doctor if you have any of the following: fully saturating 2 pads front to back in 1 hour for 2 hours in a row, passing blood clots larger than a lemon, or having symptoms like dizziness, lightheadedness, or a racing heartbeat. This is not normal and you should seek immediate medical attention. Thank you for watching this video about what to expect during your recovery. If you found this helpful, please continue on to the next video about medications and vaccinations during this period.